Hi dear students, so my topic will be about characteristic of ethyl alcohol. So firstly, let's speak about effects of alcohol. So how does it affect? Firstly, local action. So applied to delicate skin or mucous membranes, it produces irritation and burning sensation. Concentrated alcohol spirits should not be applied in the mouth, nose. Injected, it causes intense pain, inflammation and necrosis followed by fibrosis. Injected around a nerve, it produces permanent damage. Applied to the surface, alcohol is an astringent, precipitates surface proteins and hardens the skin. By precipitating bacterial proteins, it acts as an antiseptic. Its action increases with concentration from 20 to 70%, remains constant from 70 to 90%, and decreases above that. 100% ethanol is more dehydrating but poor antiseptic than 90% ethanol. Shows that antibacterial action is not due to dehydration of bacterial protoplasm. Alcohol doesn't kill bacterial spores. Central nervous system. So alcohol is a neuronal depressant. Since the highest areas are most easily deranged, and this is primarily inhibitory. Apparent excitation and euphoria experience at lower plasma concentrations, so from 30 to 60 milligram per deciliter. With increasing concentration, mental clouding, disorganization of thought, impairment of attention, memory and other faculties, alteration of gait and perception, and drowsiness supervenes. So at 150 to 200 milligram per deciliter, the person is sloppy, ataxic, and drunk. So you see that CNS acts like depressant. Next, it's cardiovascular system. So action on cardiovascular system of ethyl alcohol depend on dose. Small dose, you see moderate dose and large dose. In small dose, alcohol produce only cutaneous, especially on the face, and gastric vasodilation. Skin is warm and flushed, and there may be conjunctival injection. Blood pressure is not affected. Moderate doses. So in these doses, ethyl alcohol cause tachycardia and a mild rise in blood pressure due to increased muscular activity and sympathetic stimulation. In large dose, ethyl alcohol causes direct myocardial as well as vasomotor center depression, and there is fall in BP, blood pressure. Epidemiological studies have confirmed that chronic alcoholism contributes to hypertension and can lead to cardiomyopathy. Atrial fibrillation and other cardiac arrhythmias may occur due to conduction defects and QT prolongation. So how on the blood ethyl alcohol acts? Regular intake of small to moderate amounts of alcohol, it's 1-2 drinks, have been found to raise cholesterol, HDL, and decrease low density cholesterol oxidation. Risk reduction is greatest in high risk subjects, and protection is lost if more than 3 drinks are consumed daily. Mild anemia can be megaloblastic anemia. Same is very often in patients with chronic alcoholism. So blood temperature. Alcohol is reputed to combat cold. It doesn't produce a sense to warmth due to cutaneous and gastric vasodilation, but heat loss is actually increased in cold surroundings. High doses of ethyl alcohol depress temperature regulating center. Respiration. Alcohol reputed as respiratory stimulants in collapse. They irritate buccal and pharyngeal mucosa, which may transiently stimulate respiration reflexly. However, it's better not to depend on this, because the direct action of alcohol on respiratory center is only a depressant one. Gastrointestinal system. So alcoholic beverages have variable effect on gastric secretion depending on the beverage itself and whether the individual likes it. So, however, dilute alcohol is a strong stimulant of gastric secretion. It acts directly as well as reflexly. But higher concentrations It inhibits gastric secretion, causes vomiting, mucosal congestion, and gastritis. Alcoholism is an important cause of chronic gastritis. Low esophageal sphincter tone is reduced by alcohol. Drinking may accentuate gastric reflux. Bowel movements may be altered in either direction. Acute pancreatitis is a complication of heavy drinking. How does it affect on the liver? So on liver, in any cases, it causes damaged reactions. So, however, it does mobilize peripheral fat. It increases fat synthesis in liver in a dose-dependent manner. Proteins may also accumulate in liver because their secretion is decreased. Chronic alcoholism exposes liver to oxidative stress and causes cellular necrosis followed by fibrosis. Acetaldehyde produced during metabolism of alcohol appears to damage the hepatocytes and induce inflammation, especially on chronic ingestion of large amounts. Increased lipid peroxidation and glutathione depletion occurs. These, combined with vitamin and other nutritional deficiencies, may be responsible for the so-called alcoholic cirrhosis. Regular alcohol intake induces microsomal enzymes. Skeletal muscle. So alcohol produces little direct effect. Fatigue is allayed by small doses, but muscle work is increased or decreased depending on the predominating central effect. Weakness and myopathy occurs in chronic alcoholism. And kidney. Diuresis is often noticed after alcohol intake. So alcohol induces diuresis. This is due to water ingested alone with drinks as well as alcohol-induced inhibition of antidiuretic hormone secretion. It doesn't impair renal function. Sex. Alcohol is reputed as an aphrodisiac. Aggressive sexual behavior is due to loss of restraint and inhibition. However, performance of the sexual act is often impaired. Chronic alcoholism can produce impotence, testicular atrophy, gynecomastia, and infertility in both men and women. Endocrine effects. Moderate amounts of alcohol increase adrenaline release, which can cause hyperglycemia and other sympathetic effects. Acute intoxication is often associated with hypoglycemia and depletion of hepatic glycogen because gluconeogenesis is inhibited. Glucagon thus fails to reverse it, and glucose must be given to counteract hypoglycemia. Uterine contractions are suppressed at moderate blood levels. It's a picture of ethanol metabolism in the liver. So ethanol should convert to acetaldehyde due to enzyme alcohol dehydrogenase. Acetaldehydes then convert to acetate due to aldehyde dehydrogenase. Acetate then convert to acetyl coenzyme A due to acetate coenzyme A ligase. So its conversion normally should be in the liver. Then we return to this picture again. Now about interactions. So alcohol synergizes with anxiolytics, antidepressants, antihistamines, hypnotics, opioids. They marked CNS depression with motor impairment can occur. Next, individuals taking of sulfonylurea, cefeprazone, metronidazole have experienced disulfiram-like reactions. So it's reactions when the patient takes disulfiram like treatment of alcohol withdrawal syndrome. So patient will be in a bad condition. We shouldn't take with alcohol sulfonylurea, cefeprazone, and metronidazole because of the disulfiram-like reaction. Next, acute alcohol ingestion inhibits while chronic intake induces enzymes, especially CYP2E1. Formation of toxic metabolite of paracetamol is increased in chronic alcoholics. Safe dose limit of paracetamol is lower in them. Metabolism of tolbutamide, phenytoin, and some other drugs is similarly affected by acute and chronic alcohol intake. Hypoglycemic action of insulin and sulfonylurea is enhanced by alcohol ingestion. And the last, aspirin, other NSAIDs can cause more gastric bleeding when taken with alcohol. Contraindication. So I think that ethyl alcohol can be like contraindication in any case, but especially we say firstly peptic ulcer, hyperacidity, and gastroesophageal reflux patients because of alcohol can increase the bleeding. Next, epileptics. Seizures can appear. Next, severe liver disease patients because metabolism of alcohol in the liver. Then unstable personalities, they are likely to abuse it and become excessive drinkers. And in pregnancy, because they are very teratogenically, so even the low dose can cause fetal alcohol syndrome, resulting in intrauterine and postnatal growth retardation, low IQ, microcephaly, craniocephaly, and other abnormalities, and immunological impairment. Acute alcoholic intoxication and treatment of this. It's unawareness, unresponsiveness, stupor, hypertension, gastritis, hypoglycemia, respiratory depression, collapse, coma, and death. It's a short clinical symptoms. And treatment. Gastric lavage should be given, maintain patient airway, and prevent aspiration of vomitus, tracheal intubation, and positive pressure respiration may be needed. B1 vitamin thiamine 100 mg in 500 ml glucose solution infused should be added. Then insulin plus fructose, the same, can be given to this patient. Chronic alcoholism. So chronic alcoholism, it's a social problems of problem of our time. So shortly, treatment, it's naltrexone. It's a long-action acting opioid antagonist. Then acamprosate, it's a weak NMDA receptor antagonist with a modest GABA receptor agonistic activity. And disulfiram. So disulfiram, what's the mechanism of it? Let's return to this picture. So disulfiram inhibits aldehyde dehydrogenase enzyme, and when the patient takes alcohol with disulfiram, acetaldehyde can't be converted to acetate. Acetaldehyde so causes very bad conditions for the patient, so like tachycardia, like increasing of blood pressure, high temperature, so nausea, vomiting. So, and after this, patient doesn't want to take alcohol again. So it's a treatment of disulfiram. So thank you for your attention.